Hello everyone, myself Dr. Kaustav Ghosh, a hematologist from NRS Medical College, and today we will be discussing about how to diagnose aplastic anemia. So aplastic anemia should be suspected in all the patients presenting with pancytopenia. So in the initial investigation, we have to do a complete blood count with peripheral smear to see if there is anemia, neutropenia and thrombocytopenia present or not. A reticulocyte count should be done to see if there is reticulocytopenia present or not. And to confirm the diagnosis, we have to do a bone marrow aspiration along with biopsy, along with cytogenetics, in which there will be pancytopenia associated with a hypocellular marrow. Okay, so what other investigations we have to do in a suspected case of aplastic anemia? So the organ function test we have to do, the urea, creatinine, LFT. Along with that, a X-ray of the chest and the ultrasound abdomen should be done to rule out any infections or any organomegaly if it is present or not. So generally in aplastic anemia, organomegaly is not present. Along with that, the viral markers, triple serology, along with that the hepatitis A and the hepatitis E should be done, as in some cases there can be a hepatitis associated aplastic anemia. And to differentiate aplastic anemia from inherited bone marrow failure syndrome, we have to do the stress cytogenetic study, especially in individuals less than 50 years of age, to see if it is positive or not. In aplastic anemia, it is negative, and it is generally positive in inherited bone marrow failure syndrome such as Fanconi anemia. Also, a PNH clone study should be done, as if the patients have a PNH clone present, then they have got a better response to the immunosuppressive therapy. If in many cases it can be difficult to differentiate aplastic anemia from the hypoplastic MDS, in that cases the cytogenetic study as well as the mutation study of the myeloid genes by next generation sequencing is required to differentiate the hypoplastic MDS from the aplastic anemia. Also in aplastic anemia, dysplasia is generally absent and the blast count is generally not increased, whereas in the hypoplastic MDS, there will be significant dysplasia present associated with or without increase in the blast. So other test which should be considered in the diagnosis of aplastic anemia is to rule out the nutritional deficiency. So serum iron and a serum vitamin B12 and the folate profile should be done in all the cases. And other tests to differentiate the aplastic anemia from the constitutional symptom, HbF value is very helpful, and in any case suspected with autoimmune features, ANA at least should be done in all the cases. So finally, after diagnosing aplastic anemia, as I mentioned, it is a rare but a very serious blood disorder. So a urgent hematologist opinion is of utmost importance after the diagnosis. Thank you.